Most therapists feel most comfortable working with neurosis. So we used to divide mental illness into neurotic disorders and psychotic disorders. Neurotic disorders being seen as functional illnesses, whereas psychotic disorders were seen as being biological driven things. The belief was that things like schizophrenia, which is probably the most well-known psychotic disorder, was something that was a very biological thing. However, we know from the work of people like Martin Doherty and his colleagues that looking at the impacts of childhood trauma, that 3 childhood traumas before the age of 18 increase your level of pathology level psychosis by 18 times, but that 5 traumas increase it by 193 times. So there's a huge dose response, that the greater the dose of childhood trauma, the greater the risk of a pathology level psychosis that will bring you to a psychiatrist or psychiatric service. So whenever we begin to look at EMDR as a trauma-focused approach looks at psychosis in just exactly the same way as it does a phobic state or a generalized anxiety disorder or a post-traumatic stress disorder, which would theoretically be within the neurotic category. However, we see that these are just as treatable with EMDR. This is really important. If we look at a country, for example, when I taught in Argentina they were very influenced by the work of Melanie Klein. And so if a person had a diagnosis of schizophrenia, they would be offered a psychotherapeutic intervention just as much as they would be offered medication. And I think that the medication, whilst important, is often depended upon and to the exclusion then of psychological endeavour. So what I found in the work that I've done is that individuals who have had psychotic episodes with appropriate medication used were often able to get away with lower doses and also then be able to have that person be free of medication after a period of time of appropriate therapy. The way to think about it is that the traumatic material is something which can be driving a disorganized mental state, and in terms of psychosis, they can be monosymptomatic delusional disorders, so beliefs about body parts being the wrong size, shape or form. They can be about beliefs where people are talking about them or the hearing of voices, and right through to the complex picture of schizophrenia with functional impairment. I think if we go back to the original name, the schizophrenias is a plural term, and it was coined by Eugen Bleuler. And Eugen Bleuler, when he coined that term, was thinking very much about the effects of trauma and of dissociation. However, at the time, the person who was in the ascendancy was the work of Sigmund Freud. And so Sigmund Freud and his work at that time was in correspondence with Carl Jung. And Carl Jung had been working with Eugen Bleuler at the time. And so actually the effects of those ideas from Freud were apparently then influencing Jung. However, in the correspondence, which Andrew Moskowitz has written very elegantly about, the correspondence between Sigmund Freud and C.G. Jung also talk about another character, and that's the character of Pierre Janet. And Pierre Janet, who was a Frenchman, talked a lot about dissociation, and really now we consider him the father of dissociation. But because he was unpopular, whereas Sigmund Freud was popular, whenever Bleuler wrote about the schizophrenias, he talked about looking at it through the eyes of Freud, whenever actually the correspondence reflects that he was taking into consideration much more the work of Pierre Janet. So trauma dissociation has always been at the heart of psychotic disorders, and I think they are spectrum, the schizophrenias, plural. And at one end, there probably is a very biological form of that presentation which doesn't really respond to psychotherapeutic endeavour, but I think there's a lot that does respond incredibly well. Now, the Dutch have done a lot of work in this area, and so one of the things that they say, there are different categories that we can look at. So some people are traumatized by their diagnosis of psychosis and by the treatment they've received. So in a sense, as an EMDR clinician, we might work in that situation with the person's experience of receiving a diagnosis and receiving certain treatments. which can include the deprivation of liberty. But that there are some people that the trauma which has happened, that is the disorganizing force which has resulted in the psychosis. And so by treating that, we see the psychosis decrease and resolve. And I've seen that now many times. And once we see that, people tend to remain well in the longer term and don't return to those same beliefs that they presented. One example of that would be a person who presented with what we call walking corpse syndrome, or Cotard's. And in Cotard's, the person believed that all their internal organs had died and were rotting, and that they were outside shell. He was completely convinced of this. And this had come whenever he had unwittingly opened the door to a terrorist gang who then burst into his home. And by working on that original trauma, his belief that his internal organs were dead completely resolved, and he returned to wellness and went on. Having followed him up for a number of years, he was never to experience a relapse of that symptom. And when I spoke to him at the time, after he had recovered, I said, well, what do you think that was about? Do you remember believing that you were dead? And he said, yeah, I remember. I think it probably was the closest that I could come to explaining how badly I felt. And I think that's the beauty of it, that these things, although they seem really strange, that they have meaning, and that every part of them has meaning. And as such, we need to pay attention to them and not ignore them. Karl Jaspers formulated the approach over 100 years ago that psychosis was unintelligible. In other words, it meant nothing, it was meaningless. And because of that, the role of psychotherapeutic endeavor in the treatment of schizophrenia and psychosis was quelled. And I think that was a real shame, but we now see that paying attention to it has meaning and helps people to return to wellness. And I think we've had 100 years or more of a medication-only approach, or a biological-only approach. And I think it has failed spectacularly. And we see work such as that in Western Lapland of the open dialogue approach, where using psychotherapeutic endeavor alongside of medication in these individuals actually helps them to return to wellness, to work, and to the building of a resilience and a post-traumatic growth. So it's important now that we really throw off an old position, which was espoused by Karl Jaspers, because it really no longer is fit for purpose. I think it is time for us to change the narrative and give the narrative to psychosis, which is much more hopeful and much more helpful to individuals who are suffering from it.